Alzheimer's disease is a huge and increasing public health challenge in aging societies. And it's really important to try to find the means to early diagnose the disease, to prevent and treat the disease. I think the case symposium was a fantastic and very important event, and putting together all these worldwide experts, the fruitful discussions in the meeting and the articles that we got from that meeting, it has been very important. And I see that symposium as a starting point for future collaborations, joint efforts, really trying to find better means to manage Alzheimer's disease together. This issue includes 7 very unique articles covering the different aspects in Alzheimer's field. It's everything from the new diagnostic criteria to the concept of mild cognitive impairment, prevention and treatment, the drug development, and the pathways leading to Alzheimer's disease, and even health economic aspects. And the authors come from different areas. They are basic scientists, epidemiologists, clinical researchers, so there is a really combination of different type of articles. This issue, I think, gives a very nice picture of what has happened in the field of Alzheimer's disease during the last 10 years, and highlights the developments in early diagnosis that is very important, especially when we find disease-modifying drugs. And it clearly shows that how we have understand more about the etiology of Alzheimer's disease, how we can use the modern techniques, neuroimaging and biomarkers to early diagnose Alzheimer's disease. This issue also shows that we have now more, I would say, open picture about Alzheimer's disease, a broader picture, so that we believe that targeting, if we find targets for drugs, we need to have multi-domain interventions, not only targeting one molecule or one mechanism. And we need to have a life course perspective to really manage the disease. We need to have multi-domain interventions to effectively prevent and treat this disorder. The articles, all of them, I would say, discuss a lot the new proposed criteria for Alzheimer's disease. And there are actually 2 sets of criteria. And we discussed what are the differences, what are the similarities, is it possible to find a consensus and harmonize the criteria. And this is, of course, very important to move forward the field of Alzheimer's disease. So our perspective is much broader than earlier.